we are introducing Prader Willi syndrome.
Prader Willi syndrome, exhibiting characteristic facial appearance including narrow temples, elongated face, and a thin upper lip and a prominent nose. The pathophysiology is a rare genetic disorder in which 7 genes on a chromosome are deleted or unexpressed in the paternal chromosome. It was first described in 1956 by Andrea Prader, Hendrik Willi, Diegel Faniconi of Switzerland. Growth and development. Related to characteristics of PWS is a low muscle tone, short stature, incomplete sexual development, cognitive disability, problem behaviors, and a chronic feeling of hunger that can lead to excessive eating and a life-threatening obesity. Delayed milestones, intellectual delay. The incidence of PWS is between 1 in 25,000 and 1 in 10,000 live births. The signs and symptoms and clinical features as described the following, will not always be present: infancy in utero, at birth, older infancy, and youth childhood. Infancy in utero is decreased fetal movement, frequent abnormal fetal position, occasional polyhydrangeas, excessive amniotic fluid. In birth, often breech or cesarean birth, lethargy, hypertonia, feeding difficulties due to poor muscle affecting sucking reflexes, difficulty establishing respirations. Hypogondian describes a diminished functional activity of the Gondis, testes, and ovaries. Older infancy is a failure to thrive, delayed milestones and intellectual delay, excessive sleeping, strabius, which is cross-eyed, scoliosis, often not detected at birth. In youth childhood, speech delays, poor physical condition, hyperphagia, overeating from age 2 to 8. Note, change from feeding difficulties to overeating in youth adults. Before in childhood, they don't have the muscle to eat. Now they have difficulties from overeating. Excessive weight gain, sleep disorders, and scoliosis. In adolescence, delayed puberty, short stature, obesity, extreme flexibility. The treatment, however, the treatment, no cure. However, several treatments are in place to lessen the condition's symptoms. Non-prescribed treatment include during infancy, subjects should undergo therapies to improve muscle tone, also speech and occupational therapy. Also, because of increased obesity, obstruction, sleep apnea is a common sequelae. Positive airway pressure machine is often needed. The prescriptions prescribed of a daily recombinant growth hormone injectable are indicate for children with PWS. GH growth hormone supports linear growth and increases muscle mass and may lessen food preoccupation and weight gain. Society and culture. PWS has been depicted and documented several times in television. It appeared in United Kingdom media July 2007 when Channel 4 aired a program, Can't Stop Eating, surrounding the everyday lives of 2 people with Prader Willi syndrome, Joe and Tamara. Society and culture. An individual PW featured in episode entitled Dog Eat Dog, CIS aired 24th of May, as well as Taiwan newspaper article, Group urges more support for PW sufferers, appears in a Taipei Times in December 2011. Actress Maya Blanket, former star of TV's Blossom and currently playing neuroscientist named Amy Farrah Fowler on The Big Bang Theory, completed her PhD in 2009 with a dissertation on Prader Willi syndrome. Priority problems and 3 interventions each include 2 priority problems. 1 is feeding difficulties at birth due to poor muscle tone, affecting sucking reflexes and failure to thrive in older infancy. The interventions include 1, may have to have an NG tube, 2, do weights, 3, record in and out. The second intervention for a second priority problem is difficult establishing respirations. Interventions include O2 saturation monitoring and respirations, administering O2 PRN below 0.5 liters per minute if infant, and monitoring skin color. Thank you very much for helping me with the Prader Willi syndrome. Okay, this is me. Okay, thank you very much. Now we